Um, so welcome to today's Dissemination event, where we will explore the impact of the cost of living crisis on the Polish community in Scotland. I'm Magda Czarnecka, I'm CEO of Phoenix, and it's a pleasure to open the space for conversation and learning. Today's event is based on our research, the cost of living crisis and Polish community in Scotland, understanding impacts and inequalities. The research highlights the tough realities many Polish migrants face, things like financial struggles, limited access to social security, and language barriers when trying to navigate essential services. While the research focuses on Polish community, these challenges are not unique to them. They mirror the experiences of many other migrant communities across Scotland. We are lucky to have David Riley from the Poverty Alliance with us as our keynote speaker. He'll be sharing his insights on tackling inequalities and creating stronger, more inclusive support networks. I would also like to say a big thank you to Anya, our Community Research and Engagement Officer, for seeing this research through to the end. It was an unusual project, blending both qualitative and quantitative methods, which required Anya to take a flexible and thoughtful approach to data analysis. Her hard work and dedication have been key to this success, and we truly appreciate everything she's done to make it happen. Why this research matters? Through our work at Phoenix, we see firsthand how ongoing crises like Brexit, COVID-19, and now the cost of living pressures stack up, making life even harder for migrant communities. The findings in this report back up what we see on the ground every day, highlighting the urgent needs for action and support. It's not about just the statistics. It's about real people's lives and making sure the voices are heard. So we have a little agenda for today's event. Of course, welcome and introductions. Then we'll move to the presentation of the research findings, community voices and lived experiences. Then we'll move to keynote speech by David Riley, and of course the discussion and Q&A session. So let's get started. Thanks again for being here, and I hope you find discussions meaningful and valuable.
Okay, hello everyone. I hope you can hear me all right. Good morning. Thank you, Magda, for the introduction, for everything, and thank you everyone for coming and joining us at this event today. Here's the plan of my presentation. I will be starting with providing a broader context for the research project that we've been working on, also explaining why we feel that this study was necessary. Then I will move on to the report itself to discuss the findings. We'll go through the financial situation, mental health impact, vulnerable groups, and the barriers to support. And then at the end, I will present to you our recommendations that we came up with to address those issues. So let's start at the beginning. Phoenix, as many of you know, was established in 2007 to support Eastern and Central and Eastern European communities in Edinburgh and across Scotland. So that's nearly 2 decades of experience working with people, very often with complex needs. And according to the latest Scottish census, there are over 90,000 Polish people living in Scotland. And that includes 16,000, more than 16,000 living in Edinburgh, which makes Polish citizens the largest single nation minority ethnic group in Scotland, which is 1.67% of the population. Now, despite this relatively big number of people, research into Polish community remains quite scarce. And one of the key issues behind that is that ethnicity data is often very inconsistently collected or categorized. Sometimes we find Polish people classified under white or other white or Eastern European, or sometimes even completely omitted. So this lack of clear data contributes to the community's invisibility, limiting awareness of the challenges that Polish migrants face, and also, in turn, the development of appropriate support. That's why at Phoenix, we have conducted multiple research projects on Polish and also Ukrainian communities, and all of the reports are available on our website. Our study into suicidality among the Polish men found that they are twice as likely to die by suicide than their Scottish counterparts, with the contributing factors including cultural stigma around mental health and reluctance to seek help. Our research into the Polish unpaid carers highlighted the struggles of this often overlooked group, burdened with responsibilities and facing multiple barriers due to limited understanding of healthcare and benefit systems. What other research tells us? Tells us that Polish migrants are disproportionately employed in low-paid, precarious employment, and that they face challenges in securing stable, affordable housing. Research on minority ethnic groups and the cost of living crisis shows us as well that they are disproportionately affected by it negatively, and that they face disadvantages from the very start. And our research also confirms that. So the aims of our research were to understand how the cost of living crisis affects Polish community in Scotland, to examine the impact on mental health, to understand and explore the barriers to support, to identify groups that are more vulnerable, and to provide recommendations for improving the support. Our methodology. So we employed a mixed method approach, which means that we used online questionnaire where 112 Polish participants answered questions. The questions were about financial situation, about their coping strategies, about their mental health. Then we held 2 focus groups with Polish senior citizens, one in Edinburgh and one in Glasgow. And then finally, we carried out expert interviews with Polish energy advisors to explore the systemic challenges and barriers. Now, we wanted to have their perspective, their professional perspective, to help us understand the structural barriers and what makes it difficult for people to navigate the services. And also because we know that people often don't connect their own personal struggles to the wider inequalities. In total, there was about 150 people that took part in our project. And also the data was all collected in Polish, then later translated into English to make it more accessible to our participants. So let's move on to our findings. Let's start with the financial situation. So to evaluate the financial situation of the participants, we asked them several questions regarding different aspects of it. The answers that they gave us paint a picture of struggle and hardship. When we ask how their situation has changed since the previous year, half of our participants reported a significant decline, and yet another quarter described a moderate decline of their financial situation. Over half of households in our study earned less than £30,000 a year, and more than a quarter earned below 20,000. Is that enough? Well, 38% of respondents found their income insufficient and struggled to meet daily living costs. Another 41% said that the income was enough to cover the expenses, the daily expenses, but there was nothing left for them for savings. How does it affect the daily choices? Well, 72% of participants said that they had to reduce their heating in their home to save money. 13% struggled to pay the bills, and 6% fell into energy debt. It is worth taking a closer look at the housing situation, as it may explain some of that. So, as you can see, the participants were almost evenly split into three categories. People who owned home with a mortgage, people that lived in social housing, and people that rented privately. Now, it's quite important to point that there is a big disparity in home ownership between the Scottish population and Polish population. It is 66% among Scottish nationals and 35% for our participants. And for our participants as well, the housing cost placed a significant strain on their finances. Over half of them had just £200 left weekly after all their housing costs. So that was 200 to cover all their living expenses. And alarmingly, 8% reported having nothing left in their budget after paying their housing costs. So when we talk about hardship, people develop strategies to cope. We asked about that. Our participants told us that they have adopted strategies to cut down on expenses, or they looked for ways to increase their income. And on one hand, these approaches reflect the resilience and resourcefulness of the community. But on the other hand, they also highlight the difficult sacrifices that many had to make out of necessity. When it comes to reducing spending, that often meant cutting back on discretionary expenses such as home renovations, social activities, or entertainment. However, for many, those adjustments went even beyond the non-essential spending. Grocery shopping had to become more calculated, with participants switching to cheaper discount shops, relying more on frozen and canned food, and reducing the variety of fresh produce. For some, that wasn't enough, and 1 in 9 participants had to start using food banks. And just like with all the other strategies, like with reducing the heating, we have to ask ourselves, what are the long-term consequences of those decisions, like having a poorer diet or living in the cold home? When it comes to earning money, as we can see, employment did not automatically secure financial stability for our respondents. 3/4 of the participants were in some form of employment, either full-time or part-time. And yet, for 1/3 of all working participants, their income was not enough to keep up with increasing costs. The strategies to bring home more money revolved around earning more, either by changing current job for 24%, looking for additional hours for 25%, or looking for additional sources of income, such as maybe selling clothes for 24%. And yet, for 30% of our participants, they had the feeling that they cannot afford to lose their job or not to work, for example, because of, illness. And finally, when it comes to asking for help from an external source, we have an interesting picture. 6% of our participants reported taking out a loan, an additional loan. 10% showed participants borrowed money from friends or family. 10% participants made use of institutions and organizations. And again, 10% went to the energy advisor. Now, those relatively low numbers of people seeking help from outside organizations and institutions is consistent with the results of the study on the mental health and suicides of Polish men, and can also be partially explained by the strong emphasis Polish nationals place on self-reliance. Most of the participants admitted that they were not aware of available support, and some also did not believe that they could be helped. The decline in financial stability obviously has a significant impact on mental health. For many participants, they reported experiencing persistent worry, with over a third experiencing high levels of anxiety frequently. A similar portion described feeling desperate almost all the time. This ongoing stress manifested physically for them, and around 40% reported having difficulties falling or staying asleep regularly. Alarmingly, 25% reported some degree of suicidal ideation. Our participants also talked about different emotions, the whole range of them. They talked about sadness, they talked about anger at the system. And I think it's worth mentioning here that the basic needs like housing or food can be met, but if a person is lacking resources for activities that promote their well-being, such as socializing, exercise, and self-care, that increases isolation and that undermines mental resilience. So there's this clear connection between financial situation and mental health well-being. Right. So moving on to the vulnerable groups, from the very design of our project, we were interested in looking at different groups within the bigger Polish community. And our results confirm that there are certain groups that are more vulnerable and more negatively affected than others. We'll start with single parents. Those accounted for 15% of all the families that took part in our study, and all of them identified as women. Single parents families, moms, they were most worried about money and scored the lowest on all mental health metrics among all participants. 60% of them lived in social housing, which is double the rate of the overall participants group. 60% of single parent households lived on less than £20,000 annually, and not surprisingly, 8 out of 10 found their income insufficient to cover basic costs. One mom, when asked what she had to stop buying, started counting. She said, heating, hot water, clothes, entertainment, food, cleaning products, and everything else. Moms also mentioned feeling very guilty in their answers, feeling guilty for not being able to provide their children with more activities and entertainment. And I would also like to mention here that Phoenix has a lot of experience working with women, many of whom became single parents due to domestic abuse. During the COVID-19 pandemic, we observed many women getting trapped in very difficult situations, on one hand, unable to afford childcare and forced to stay at home. For those women, the cost of living crisis has only intensified the existing inequalities, making it even harder to escape the vicious cycle of poverty and hardship that started with the experience of abuse. Another group that stood out from other participants as more negatively affected were people with disabilities and unpaid carers. None of our disabled respondents could save money at all, and half of them said that what they had was not enough to live by. Regarding mental health, individuals with disabilities scored higher in anxiety and panic attacks levels in comparison to rest of respondents. These disadvantaged groups, even though most of them received some level of social security benefits, still experienced poor outcomes in terms of financial stability and mental health, which tells us that persistent barriers and insufficient support continues to hold them back, despite the support they receive and also their own efforts to reduce spending. Interestingly, also, a third of those who identified as disabled did not receive any form of social security benefits. Now, it is unknown why that was the case for those participants, but one of the participants left a comment. Despite my sick leave, my payments, benefit application, and account were suspended. This is how sick people are treated by the job centers here. And to me, it suggests that at least some people feel that they are treated unfairly, that they don't understand the system, and that they feel quite powerless against it. And finally, our third group, those are senior citizens. So with a little bit of context, it was very common for the grandparents to relocate to Scotland to join their children and grandchildren. And that, of course, brought about challenges which may come with such a change later in life. That's why the group Active 50 Plus was established by Phoenix due to the needs in the community to address the isolation, the language barrier, and to create opportunities for sharing and for learning. This group was established 9 years ago, and now the group is aging, and there are new challenges and new needs among the members of the group. For example, growing number of cases of dementia among the members. When it comes to our study, over half of the senior participants expressed serious concerns about their financial situation. With prices increasing, seniors have adopted careful spending strategies. They were very creative and had a lot of ideas. They talked about seeking discounts, comparing prices, reducing consumption of certain products, not taking their grandchildren shopping with them. They all agreed that resourcefulness and frugality are common among Polish people. A lot of them talked, and not just the older participants, they talked about trips to Poland and how important they are. They are in a way essential, and they serve a lot of different purposes. Among them, not just leisure, among them maintaining connection to family and friends, addressing medical and legal matters, attending significant events, and especially the medical treatments that was very, very common and mentioned by many people, going back to Poland to get the dental treatment or to go to a sanatorium, to the treatment facility. However, when questioned about their sources of information and advice, participants agreed that they lacked sufficient knowledge about changes in benefit system and pensions that could affect them. They struggled to verify information due to language barrier, particularly with the complicated legal terminology, and they had difficulties in accessing relevant resources. To cope with that, many of them relied on the word of mouth or assistance from family and friends. Also, a lot of them admitted that they don't like saying that they have a problem because they don't want to be seen as inferior. Also, they mentioned that sometimes and here's a quote, because you also need to know what kind of a problem you have to deal with it. And we know that there are many things we don't know, which shows us that in order to look for appropriate support, you also need to know where to start. You need to have some knowledge at the beginning to know what to ask about. And now we're moving to the barriers to support. This is based on the questionnaire and focus groups, but in a big part on the interview with Evelina from Edinburgh and Lothian Regional Equality Council, ELREC, and you can read way more about it in the report. I'll just say about some of the common barriers that Evelina mentioned that many of her clients face. So communication and accessibility, they often come together. The issue is not only the language barrier, but there's more. There's lack of translated materials. And if there are some materials, very often you need to take many steps navigating through an English website to get to them. And that can be a barrier in itself, especially for seniors or some people that struggle with online services. Evelina talked a lot about telephone interactions that can exacerbate the issue because many clients avoid at all costs making calls due to the fear or lack of confidence. And that's a trend we've seen since COVID, when everything stopped being in person. Another barrier identified is the lack of awareness surrounding available support services. Many clients learn about those services through the word of mouth, revealing that there is a gap in institutional outreach towards the communities. Many people are not aware of the entitlement that they could be getting because they often feel that they are not allowed or that they shouldn't ask for it because they are not Scottish. Also, fuel poverty is an especially prevalent issue among social housing tenants, yet there's a problem that there's a very small number of housing associations that offer in-house energy advisors. A lot of the clients, once they receive the keys to their new home, are left alone to figure out on their own how to deal with all the energy-related issues. And that leaves us here on our recommendations. So our recommendations, some of them are more general, some of them are more specific. We thought of addressing the problems from different directions. They will not only, they are specific not only to the Polish community, but to every migrant community as well. So we have the first one, streamlined access to benefits to simplify the process for accessing social security benefits and to provide more dedicated support to help community members that struggle to navigate those systems. Then we have more proactive and accessible services. That's everything I said about the language, particularly for public and third sector organizations, having a more proactive approach in reaching the vulnerable communities. That would include actively promoting services, ensuring accessibility, both digitally and linguistically. That goes for interpretation services, translated materials, multilingual resources, easily available on the website. Then we have human rights advocacy to establish this type of roles in Scotland to assist Polish and other communities in accessing services and support and claiming their rights. that would be particularly valuable when public bodies fail to meet their obligations, or when the individuals lack the capacity or awareness to advocate for themselves. Then we have improved equality data collection. That's what I said about the lack of data and research on Polish community. So we advocate better collection and accessibility of nationality and ethnicity data to facilitate the research into vulnerable groups. Then we have targeted support for vulnerable groups. So to recognize the challenges, the additional challenges that some groups face, we are recommending tailored support for single mothers that are disproportionately affected by the cost of living crisis. That could be access to more affordable childcare, more benefits advice, mental health support. For older Polish migrants, people with disabilities, and unpaid carers, more information or energy, healthcare, social support services in a format that is easy to understand. That would be essential. Now we have some suggestions for supporting renters in high-cost areas like Edinburgh. So we've seen that housing costs are very high, and that leaves people with very little money to live on. And I think that should be reflected in the way universal credit and the housing support are given. The benefit cap could be adjusted. So that's just like in Greater London, the benefit cap is higher, and that reflects the higher costs of living in those particular areas. That could also apply to Edinburgh. Also increasing the local living wage, same, just like in London. Then we have proactive policy engagement and collaboration, engaging with local and national policymakers to advocate for policies that address the unique needs of the ethnic minority groups, and strengthening collaboration with third sector organizations. And finally, energy advice and support services, establishing free energy advice services that would be tailored to Polish and other migrant communities' households to improve the understanding of energy usage and to help reduce costs. Also, social housing providers should offer better induction for the new tenants on managing their energy needs. Yes, that's just a very quick overview of the recommendations and of the report. I will now move on and give the mic to David, but I welcome all the questions later on in our discussion part. So David, to you.
Thank you, Ania, and thank you, Magda and Dorota, for inviting me to speak, and congratulations on the report, and thank you for your presentation. I'll keep you for 6 or 7 minutes. Perhaps I'll share some reflections from Poverty Line's point of view about your excellent report, talk a little bit about the state of play and of poverty more generally in Scotland, and end with a call to arms of how we can demand better for our communities and our people across the country. Firstly, I work at Poverty Alliance. We're in our 30th year. We're an alliance of around 450 members across Scotland. With members, we stand against the injustice of poverty and support communities to challenge poverty. And members like Phoenix are so vital because of your understanding of the unique challenges faced by your community, as well as the unique assets and skills and talents within your community. We at Poverty Alliance, like you, we carry out research to improve understanding of poverty, things like stigma. We support participation of people in communities to amplify the voices of people experiencing poverty. We do policy and campaigning to build support for the actions against that would have effect against policy such as your recommendations, and we host Living Wage Scotland because, as you say, Anya, good work should be a route out of poverty and it should shield us from poverty. Some reflections on the report. We think it's an excellent and important report that adds to what we know about poverty in Scotland. I'm always minded in research advice from the King's Fund in London that to be effective research should have no numbers without stories and no stories without numbers. And I think you managed to capture both, which is very much to your credit. Some of the points that jumped out to me was a central point that the impact of poverty and cost of living extends far beyond finances. It's about more than money. You know, as you identify people struggling with sleep and feeling desperate all the time, it's about more than money, although important money is. About the unequal impacts of poverty. We're not all at equal risk, and that is part of the injustice of poverty. That, as you say, disabled people are most at risk. Unpaid carers, women who are single parents bear the burden of poverty and managing family poverty. And that shows how structural poverty is. It's not the fault of those people in those groups. It's because of the way our society is structured, and we can take actions to change that. I thought it was really important that you call for a human rights-based approach. And we think that's vital, both in terms of our campaigning, but also in how we speak to people about poverty and sometimes the guilt that they internalise about poverty, that poverty is not their fault, that our government have made promises to us that we should be able to live in dignity, free from poverty, and that what you in your report find is that those promises are not being upheld, and it is the duty of government to uphold those promises. The fact that so many participants aren't able to heat their homes as they would like, saying that they live in a cold home. You know, we can't rely on community interventions like warm places that were trialled a couple of years ago to heat people. Our homes should be our warm places. It's a fundamental human need which we should be able to access equally. And the Polish and Eastern European and immigrant communities must have that right as much as anyone else in Scotland. And I think as well, really importantly, what you highlight is the unequal access to what support that is available, the language barriers, complex systems, lack of awareness, and the impact that that has. I was really struck by one of your participants saying, I can't cope and I don't think I'll get help even if I ask for it. You know, that's heartbreaking to hear. We must design our interventions with those barriers and people's needs in mind, also poverty-related stigma in mind. We know that a one-size-fits-all approach isn't effective. And we know as well about the impact poverty has on mental health, and I think you do a great job of highlighting that. Across Scotland as a whole, we've identified this idea of priority family groups because there's been a welcome recognition that all communities are not at equal risk of homelessness. But I think where we've not been successful is in recognising that each of those priority groups require careful approaches that need to be taken. One of those priority family groups, as you say, is Black and minority ethnic communities as a whole. And it's important that we put focus into driving down the higher levels of poverty within that community. But those are many communities who have many different needs. And although there's intersections and similarities, they're not the same. And we can't fall into the mistake of thinking that a one-size-fits-all approach can work. It doesn't give appropriate priority. And so with Polish families, I think you highlight that we're failing to address their specific needs, and taking a one-size-fits-all approach doesn't help anyone. So we'd be encouraging Phoenix and other organisations to be supporting and following through the recommendations that you make, which will make that difference. And we want your voice to be heard. So we hope that Phoenix and the community will continue to raise your voice for the community and advocate for those practical changes that will make a difference. We hope that you'll respond to Scottish Government's consultation on its final Tackling Child Poverty Delivery Plan before the 2030 targets. Because, and here's where I'll speak briefly about the state of play in poverty generally in Scotland, that Scotland is a wealthy nation. We have a wealthy economy. And so it's a great injustice that 20% of people, 1 million people in Scotland, live in poverty, in relative poverty. And as you say, that's real people in real lives. Worse still is that around 1 in 4, 24% of our children are growing up in poverty. That's 250,000 children struggling to reach their potential. Real children with real lives that are being affected by poverty. The size and scale can sometimes be overwhelming. Trussell Trust showed in 2013 that 13% of people in Scotland living in poverty experience food insecurity. That adds up to 150,000 people in Scotland. That would be a city the size of Dundee. And emergency food responses like food banks, which are done absolutely out of love and are heroic, cannot be a response to feeding people because we don't have a shortage of food. There's no crisis in food. The crisis is in inequality, and I think that's what you show. Those levels of poverty and child poverty in Scotland are relatively stable. You could argue that's a success where poverty rates have been increasing in England, and where there isn't the same focus on driving down poverty. You could argue it's a success because child poverty has come down from higher figures, 32% in 1997, which shows that if we have concerted efforts across the United Kingdom, we can make an impact on child poverty. Because ending poverty is about political choices. We know that people exit poverty if income rises or through good employment. Poverty is not inevitable. We want to end poverty together. We want to mitigate it in the medium term. So we know the harms that poverty has on people. We know that in Scotland there's been a great deal of work and investment to drive down child poverty. It's great that in the Scottish Parliament there was cross-party support to set targets to reduce child poverty to 10% by 2030, that there was an interim target of reducing child poverty to 18%, and figures will come out next month, which should be able to demonstrate whether we've been successful in that. It seems unlikely we will be, or we have been. And I think that's especially the case when we look at some of the signals and actions at a UK level. Just this week, we've seen UK government plans shared to target the most vulnerable, with reports of a catastrophic £1 billion cut to support for disabled people. Just the high-risk group that Phoenix identifies has already been held back by sufficient support. So these are political choices, and I think we have to do more to raise our voices to demand better, and I'll end with that kind of demanding better. I was lucky enough last week to be able to go to Westminster Parliament for the first time in my life with people from across Scotland experiencing poverty, to help them have their voices heard by MPs and Lords about the impact of some of the issues you identify have on them. And when we were there, the streets around Westminster were rammed with farmers' tractors protesting against changes to inheritance tax. And that's fine, that's absolutely their right to do that. But we are sometimes asked, when the cost of living crisis and rates of poverty, what does it take to get us out on the streets? Sometimes people reflect that if you're a single parent, you're looking after multiple children, what chance have you got to join a protest? You know, how can you organise these kind of political actions? But these actions are really important to highlight issues and put pressure on government and have our voices heard in these political decisions. And so we at Poverty Alliance, we decided last month that we were going to launch a campaign, Scotland Demands Better. And we want to take to the streets in October this year during Challenge Poverty Week to come together and show government that we must make the changes in policy that will deliver tangible improvements in the lives of people who are living at a low income in Scotland. And that means ensuring adequate access to social security to address a lot of the issues that you identified. It means removing the two-child benefit cap, the two-child benefit limit, which traps children in poverty by design. It means ending the benefit cap entirely to let people use social security as a safety net to exit poverty, tackling the high cost of living, the high cost of eating and heating, and removing these choices that people have had to make, designing a labour market that works for everyone with wages that offers dignified living. And I think also important in that we have fair funding for the vital work of community groups like Phoenix to support you to do more work like this, because you're the front line against poverty for many in your community. And I think you show that through this report, that shows how vital Phoenix is to the Polish community, and I think to Scotland as a whole, because we all benefit from your work. So we hope you, Phoenix, and communities and people taking part will join us in that Scotland Demands Better campaign. I'll put some links in the chat. And I'll end by thanking you for inviting me to contribute and congratulating you again on your work together. Thank you.
Thank you so much for your presentation, Anya, and the whole report, and also David for a very insightful analysis of wider impact of the research and our outcomes. I wonder how all it will play out with the announcement of the government, the Labour government, on I think today we'll expect the announcement on the cuts on personal independence payment and possibly further benefits. So it feels like we are a little bit working against the tide. And yeah, so that will be very important for all of us to work together as well. And then, and again, I think what we kind of evidence affects Polish community, but you can expect that any other migrant community would experience very similar hurdles, whether refugees, whether other migrant group from EU. So yes, we will stop the recording now and move to the questions and discussion. Thank you. And of course, our contact details, I'll remind you that we will have a report available on the website, but we will also send it out to the event participants.